Welcome to our channel. Today, we're exploring an important topic for anyone who's had a venous thromboembolism, or VTEL. We're discussing how aspirin can help prevent recurrence after you've finished anticoagulation therapy. Let's break it down. Venous thromboembolism, or VTEL, is a condition that includes both deep vein thrombosis, or DVT, and pulmonary embolism, or PE. If you've experienced an unprovoked VTEL and completed anticoagulation therapy, there's about a 10% chance you could have another VTEL within the first year after stopping treatment. Recent research suggests that aspirin might help reduce this risk. Studies like WARFASA and ASPIRE have investigated the role of aspirin in preventing the recurrence of VTEL. Well, let's take a closer look at what they found. The ASPIRE trial, published in 2012, looked at 822 patients who had a first unprovoked episode of VTEL and completed anticoagulation therapy. Patients were randomized to receive either 100 milligrams of aspirin daily or a placebo. After an average follow-up of just over 3 years, those taking aspirin had fewer recurrent VTEL events and cardiovascular events compared to those on placebo, though these results were not statistically significant. Specifically, 4.8% of patients on aspirin had recurrent VTEL versus 6.5% on placebo, and 5.2% had cardiovascular events versus 8.0% on placebo. When combined with data from the WARFASA trial, there was a 32% relative reduction in VTEL recurrence among those taking aspirin. ASPIRE had a few limitations. The trial had slow enrollment and didn't reach the 3,000 patients needed for its power calculation. This means the study might not have been large enough to detect a significant difference. Additionally, the benefits of aspirin might vary depending on patient characteristics like gender. So what do current guidelines say? According to the American College of Chest Physicians, or ACCP, and the European Society of Cardiology, or ESC, for patients with an unprovoked VTEL, long-term anticoagulation therapy is recommended. If you stop anticoagulation and have no contraindications, aspirin can be considered to reduce the risk of recurrent VTEL. In particular, the ACCP suggests using aspirin for extended secondary prevention in those who stop anticoagulation therapy, provided there are no contraindications. So, what's the bottom line? If you've had an unprovoked VTEL and completed your anticoagulation therapy, taking low-dose aspirin could potentially lower your risk of having another VTEL. But remember, always talk to your healthcare provider before making any changes to your medication or treatment plan. Thanks for joining us today. If you found this video helpful, give us a thumbs up. And don't forget to subscribe for more health insights. Leave your questions or experiences with VTEL in the comments below. See you next time.